Thank you for listening to Fem Talk 89 FM. We are on air in Suva, and it is time for another episode of this new season of Radio with Pictures on MyTV. Thanks to the support of UNDP's CAFE program, supported by the European Union, DFET, and the International Women's Development Agency, as well as Oxfam.
Welcome back to another episode of Radio with Pictures with FemLink Pacific. In this new season of Radio with Pictures, we've heard from representatives of 50 women leaders from Ra to Nanronga, representing more than 3,000 women of all diversities, including young women and the LGBTIQ and disability rights groups. In Vanuatu, 50 women leaders joined us from Rambi and Savsavu, Mbua, and communities of Madawata province, including Kia and Mali, to discuss the experiences of 600 women from their clubs and groups. Priorities included health services, transportation specific to health services, the quality of roads connecting communities, electricity, water, and the concerns also about sea level rising and environmental security. Other priorities have included access to education, improvements or development to their community infrastructure, including drainage, and employment connected to food security and access to land. In the coming 6 episodes of Radio with Pictures, you'll have a chance to meet women leaders who have joined us from the Navua to Nosori corridor from our Central Division consultation. 24 women leaders have brought their communities' experiences and priorities to our discussion on what they feel are essential in terms of national development and national budget. Here are the women to discuss their priorities in this episode of Radio with Pictures. We have Anna Fasad. Anna is from the Grace AOG group in Nosori. We have Kasaya Rokombati from the Narere Youth Group in Nasinu. Rajni Kumar is a member of WinNet based in Suva. And FemLink Pacific's own Alicia Evans joins us in this episode as well. Anna, let's talk first of all in terms of leadership. You're a leader in your community, in Nosori, in your church group, in our monthly network meeting. We have great numbers of women just within Nosori organizing, right? But there are obstacles to decision making. What are these obstacles that you're facing in terms of getting your issues from the club level to the district advisory or the provincial council level or provincial planning?
Thank you, Sharon. One of the barriers we face is that we don't have any advisory council who is a female, who is a woman. And in taking up issues, even though complaints are going, they are not addressed. Why? Because men, they are not taking it seriously, maybe. And I think that that's something that needs to be looked into.
So your priority, we were discussing earlier, is health services. And we've had a number of conversations with you in the past, and you've talked about the health services having to go to the divisional medical center and spend an entire day, and all you get then is Panadol. What are the health service improvements you'd like to see then in the new development plan and in the national budget for 2016?
The first thing I'd like to see is, since Nosori Health Center caters for a large area, I think that we need to have dispensaries in our community. Like where I live, we don't have a dispensary in Korodiri, and there's none also in Vusia to cater for a lot of people living in that area. So one of the main things is having dispensaries, so that instead of people going over to the health center and lining up there, taking them hours so long, and waiting to be seen by a doctor, if we have dispensaries, we can be seen there once a week. That will be okay, or even more than that. That will be very good.
Medical services, one thing, whether we have enough doctors and nurses. There's been a higher level of nurses graduating recently. But what about medicines, medical supplies? Are you getting the kinds of medicines that you need in your community? Because obviously these dispensaries will need medicine, right?
Yeah, that's a very good question, Sharon. The problem is that we are always out a shortage of medication, whether you are seen by in health centers or even with private doctors, you'll have to go and buy the certain medicine that's needed. And I'm not really sure about this the free medication that was passed, because I've heard that the medication that they are being prescribed, the doctor, they are not receiving it. And I don't know whether it's really working, this free medication policy.
So we like the free medicine policy, but we need to make sure that the medicines are actually there and available. Thanks so much, Anna. Kasaya, you're part of the Narere Youth Group, and I understand you're born and bred and raised in Nasinu. What are the priorities for you as a young woman right now in terms of the national development priority?
Thank you, Sharon. As main priorities in my area where I stay in Narere, it's just the infrastructure that I'm so concerned about. We've been doing awareness in our area to raise this problem to Nasinu Town Council, but still there's no action taken. This is just because we are so aware of the schools that is around the area, which I've just said earlier. It's a total of 3 primary schools there and 1 secondary school. So accidents been happening every week or after 2 weeks. It's just because of the lack of footpath in the roads, and especially there's sexual harassment been happening in the area because of no street lights, where I usually know because I always knock off at night, and I used to walk from Makwe to my place where there's a dark road along the place.
How long is your walk home from Makwe?
It takes me half an hour from Makwe, then I can reach home. So what I usually do when I knock off from work, I call a cousin to come and wait for me on the main road, because the street light where I'm staying, the street light just end up to Tipeye, where that FNU school is. So from that place to my place, there's no street light along the road.
Okay, so you're living in Narere Nasinu. We know it's one of the most densely populated parts of Fiji right now. We're seeing a lot of road upgrades taking place. The roads are widening. Is that only happening? So are you saying the improvements are only happening on the main highway, like heading to the airport, and not in the
streets where I'm staying?
Okay.
It's just from the main road where Makwe that runs from Suva to Nosol.
You talked about harassment on the road, so this is also an issue of your personal security and for others as well. Have you reported this to the police? What are the police services doing about this?
We've been doing that for so many months, reporting all the problems happening, but still there is no action taken by police because the only problem, or the only thing the time we call the police, the only thing they always say is there is no transport.
So there's no transport yet again in terms of police services.
Police services.
Thanks so much, Kasai. We'll come back to that in terms of what you'd like to see in the national budget and the national development plan. Rajni, WinNet, been operating for more than 10 years, started with a core group of 5 women. You now have a very active network. What are the priorities you're addressing as WinNet?
As WinNet, we work with the women's organizations, other women's organizations that are based in the community. So we do workshops and trainings and awareness for the betterment of their life.
What kind of problems, or what are the women saying they need awareness of to have a better life?
The main issue now, or the uprising issue now, is the safety within their homes and the community for elderly women and for children also, because there is a high rate of suicide issues that are coming up and violence against women that are happening.
How do you work with the Crisis Centre and other organizations now that you've got things like the Child Lifeline, with the telephone services, or the policy on the elderly? How are you trying to engage with the state services and other groups?
Yeah, if there is any concerns with regards to workshops that we have to carry out, we network with other organizations, namely Fiji Council of Social Workers, the Fiji Women's Rights Movement, and the Crisis Center. We network, and we also ask them to come and be as a resource person for the workshops and trainings that we carry out.
In terms of violence, Kasaya's just raised that for her community, the police are not responsive enough, that they're saying they don't have transport, so they're under-resourced. When issues are raised at the household level or the community level, are you getting the kind of support from the police that you'd like to see?
No, we are not getting the same kind of support because in certain cases where it could get out of hand, we would like to see more vehicles or more police support in that term.
Okay, thanks Rajani. Alicia, FemLink Pacific. We've had a couple of divisional consultations now, and we obviously are celebrating women's leadership, but there is a concern that even though women are doing such amazing work, whether it's responding to health or security issues or recognizing the need for infrastructure or providing social services, they're not in the leadership level. Is this something that you're concerned about as a young woman as well?
As a young woman, yes, I am, because if women who are so organized and engaged and aware of the issues aren't being heard, then for me as a young woman, it's not a very good position to be in. I've noticed that although the women have been trying to engage in these circles or these spaces, their voices still aren't being taken into consideration for local development plans, for example. Just in the central consultation last week, the women were saying that they had no idea that the development consultations were happening. They had, for example, the village halls where the spaces could be used, but they were being overlooked for other areas. The information wasn't being given to them. So these were the barriers that the women were facing.
What happens to a community when you're not part of decision making? Anna and Kasaya, what happens when you feel that you're not part of this development planning? Anna, how does your community feel?
We feel left out. We feel like our rights, whatever we're going through, our views, it's not being heard or taken up, because the last consultation where the government was going around, from Vudi to Korodiri and Vusia, we didn't have any consultation there, but instead it went right up to Raralevu village, and that is far away, and consultation happening at night, we women cannot get there, especially with kids.
Kasaya, you work during the day because you're having to walk home at night in the dark where there's no safety and security for you. What does this mean when you're not able to attend a consultation as important as one about your development priorities?
Thank you, Sharon. This is just because I know as a young woman, we're supposed to stand for our right to speak up, because we are the future generation of the country. We are going to be there making decisions, so we're supposed to be given opportunity and time to speak up for our right and what is going on in the area.
Are young men in your community as concerned as you are about what's happening?
Not really.
Why not? Why aren't young men interested?
Actually, Sharon, in my area, because as secretary of a member of the youth, we usually do some stars that can get men to get together with us young ladies. It's like, Fijian will mix a bowl of grog, so we can get the men closer to us, but still there's things that they are interested in, like peer pressure. They've been taking alcohol, so they're not interested in moving towards on what young women want in my area.
So there's a barrier between young women and young men, and so is it safer for you then to have just your own young women's group? Yes,
that's what we've been trying now, to form a group, young women group, so we can speak up to the Nasino Town Council or to the member of the communities on what we really need to be done in the community.
And what could be done for these young men? Because they're obviously got other interests, but they're the future fathers, they're the future leaders, just like young women are. How do we get young men involved and feeling like they can be part of this development planning?
As for me, I suggest we should give them employment opportunity, because that's the only problem that they are not interested in because they don't have work to do. So they are just staying around in the area doing nothing. So I suggest government should provide employment opportunity to some kind of places like that where young men are just staying around at home doing nothing, creating more problems in the area too. So I think we should just create more.
So youth employment, particularly for young men, young women as well, but there's a critical need to ensure that there's youth employment opportunities in the new development plan. Rajni, you talked about the violence, including suicide. What can be done in terms of the National Development Plan to ensure that, to prevent these different forms of violence that are being experienced in our families?
Thank you, Sharon. I feel that more resources in terms of vehicles or in terms of resources injected to the police community policing area, and also to certain women's organizations that are working in that area, so that there is more consultation, more awareness, and massive training given to women and also to children and elderly also.
Okay, thanks. Alicia, very quickly, in terms of health, youth employment, some of the social issues, including family violence, what are you seeing across Fiji as you look at all the information coming through our different consultations that really connect it to the root causes? What's causing all of these problems?
I think it's economic issues, the fact that the cost of living is so high for families, that they're feeling stressed and not being able to take care of the needs of their families, so they'll feel disenfranchised, they'll feel separated from the process of trying to develop their communities. So they feel like, what is the point in trying to engage when they're not even being listened to? I think that's a very big issue.
And it's something that Kasaya just raised in terms of the young men. They're not employed, and so they're feeling completely disempowered. So you've talked about what you want to see in the immediate planning process. Very quickly, Alicia, 20 years' time, what would you like to see in terms of the vision for Fiji?
I'd like to see at least, more women in Parliament, but also even a very strong candidate for Prime Minister, a female Prime Minister.
Okay, Rajni, 20 years' time, where should we be as a country?
Okay, I would like to see women represented in all levels of decision making, and also maybe female Prime Minister.
Female Prime Minister, okay. 2 votes over here to female Prime Minister. Kasaya, what would you like to see in 20 years' time? You as the Mayor of Nasino?
Thank you, Sharon. In 20 years' time, I want to see a female Prime Minister and more women to be in some organization in the country to stand for the right of the women too.
Okay, so keep on going, women's movement. And finally, Anna, 20 years' time?
I want to see, the first thing is gender equality being implemented. Since the bill has been passed, it's not really in progress. It's like a comma is there, or maybe hash, something like that. And I would like improvement in infrastructure and in health services especially.
Well, hopefully we don't have to wait 20 years to realize these development dreams of our panelists for this program of Radio with Pictures. Thank you to Anna Prasad, Kasaya Rokombati, Rajni Kumar, and of course Femlink Pacific's own Alicia Evans. As we continue with our Radio with Pictures series, more chance for you to hear what women see as the development priorities for Fiji. Until the next episode, see you then.
Thank you, Sharon. We will be back the same time next week for another episode of Radio with Pictures. And don't forget to tune in to Femtalk 89 FM Suva if you're living in the Nosori-Navua corridor, or Femtalk 89 FM Lambasa from 10 a.m. to 2 p.m. weekdays in Lambasa town.